Please, sir.
Emerging trends in indigenous medical system, the integration of artificial intelligence technologies. I am Dr. Sivadharan, Deputy Commissioner of Ayurveda, Northwestern Province, Sri Lanka. Overview of this presentation, introduction, AI-powered diagnosis and decision support, digitalization and preservation of traditional knowledge, personalized treatment planning, predictive analytics for public health, smart herbal formulation and drug discovery, integration into telemedicine platforms, training and education enhancement, regulatory and quality control systems, conclusion, references. Introduction. Indigenous medical system such as Ayurveda, Siddha, Unani, traditional Chinese medicine, and various regional practices in Africa, Sri Lanka, India, and Latin America have long histories of serving community health needs. These systems are based on holistic principles with emphasis on balance, individualized care, and a close relationship with nature. However, their integration into mainstream scientific and technological frameworks has been limited. The emergence of artificial intelligence provides new opportunities to bridge this gap, offering tools to digitalize, analyze, and apply traditional knowledge in ways that support modern health challenges. Application of AI nowadays using healthcare, automobile, finance, surveillance, social media, entertainment, education. So different sectors, they are using AI. In health sector, two divisions are there, that Western system and Eastern system. Our system is indigenous system that have to apply the artificial intelligence in future. These are the benefits if we use the artificial intelligence. Artificial intelligence powered diagnosis and decision support. Artificial intelligence is increasingly being utilized to enhance the diagnostic capabilities of indigenous medical systems. Machine learning algorithms can analyze clinical patterns from symptomatology, tongue and facial diagnostics, and pulse data to support decision making. For example, neural networks have shown potential in supporting Ayurvedic pulse diagnosis and tongue analysis for digestive disorders and other disorders. By providing pattern recognition and historical data analysis, AI assists practitioners in delivering more accurate and individualized while respecting the theoretical foundations of traditional diagnostics. In Ayurveda, that Astavida Pariksha, that 8 type of examinations are there. Nadi Pariksha, Mutra Pariksha, Mala Pariksha, Jiva Pariksha, Sapta Pariksha, Sparsha Pariksha, Drug Pariksha, act to the appearance. In pulse diagnosis, up to now, most of the physicians, they are using some manual method. That diagnosis is a unique diagnosis in Ayurveda. In that moment, the practitioners need very quiet environment and very peaceful surroundings need for that diagnosis. If we use the electronic device or sensor device, that will make very accuracy for diagnosis. Next, tongue examinations. So tongue examination, we have to make up to now manually we are find out certain things from the patients. If we use this, if we use artificial intelligence for this purpose, that make very accuracy results, that very safety for the patients, that is costly effective and very sensitive and very accuracy. In future, we have to adapt this technology in that examination. Next examination, eye examination. According to Ayurveda, Pitta, Kapha, Vata. When it comes to eye observation in connection to the one's dosa, the following are to be considered. Vata eyes are often seen as nervous, blinking is often rapid, it is small, dry and scanty, with dropping eyelids, accenting eyelashes. When given a closer look, the white of the eye has a seemingly muddy impression and the iris color ranges from brownish to black. The pitta eyes, on the other hand, are often observed to be sensitive to light through. It looks sharp and shiny. It is lustrous to look at and it is moderate in size. Kapha eyes seems to be the biggest in size among the three dosas. It is also moist and clear to look at. The white of the eye is very white in color and the lashes are long and thick. Its iris color ranges from pale to black. If we connect with the AI, that make the accurate and very sensitive results for this purpose. So in future, we have to adapt this artificial intelligence for this examination. Example here, the effective use of AI in optometry, the photo analyzed by AI that predict certain diseases, that confirm the prediction referred to ophthalmology for treatment. Next, the speech. The speech classified that diagnosis made by two aspects. Is one, the movement of the mouth and voice recognitions. If we connect the artificial intelligence with voice recognition, that make the accuracy and very quick results for the diagnosis for treatment. The spursa, that's also that sensor. If we connect with the sensor for the touch sensation, that also make the good results. The face diagnosis also that like. So nowadays there are some of the diseases make the spot diagnosis with face diagnosis. If we connect the artificial intelligence with this purpose, that make the accuracy and very quick results for diagnosis. So Mutra Pariksha and Mala Pariksha, that also we can connect with that appearance and there's a color and pattern of this Mala or urine, that make the good results for diagnosis. If we implement this artificial intelligence, we have to first discuss with our stakeholders, then we have to make the policy, then implement that artificial intelligence with the traditional medicine, then evaluate that process. These are the need for the implementation of the artificial intelligence within this traditional medicine or indigenous medicine. Stakeholders are indigenous practitioners, staff of indigenous sector, IT experts, and publics. They all together they have to make the policy for in future development of traditional medicine. Next benefit, the digitalization of the traditional knowledge. Thousands of ancient manuscripts and oral traditions are in danger of being lost due to degradation, lack of standardization, or limited accessibility. AI-powered natural language processing is being used to digitize and catalog these texts, translating classical languages and classifying knowledge systems into searchable database. Such tools support both academic research and clinical applications. So most of our text up to now in Olalive books and ancient text, some of the text in Sanskrit, that is not normally used language. If we change that Sanskrit to normal using language, that is good for the future education and future development. Next benefit, personalized treatment planning. Personalization is a core feature of many indigenous systems where therapies are tailored based on constitutional types. Doshas in Ayurveda, Vali Alal Pitta, Vali Alal Ayyam in Siddha. AI enhances this capacity by analyzing complex data sets of patients' history, herbal pharmacology, and treatment outcomes. Decision support system can propose individualized treatment plans based on both traditional principles and data-driven insights, increasing the probability of favorable outcomes. Next benefit, training and education. Enhancement AI-driven educational tools such as virtual tutors, simulations, and augmented reality are transforming the training of traditional practitioners. These tools help students understand physiological models, simulate patient scenarios, and interactively explore herbal pharmacology by blending traditional curricula with digital pedagogies. AI ensures the sustainability and modernization of indigenous medical education. Reactive analytics for public health. AI models are also being applied in indigenous medical context for public health surveillance. These tools analyze the population's level data to predict diseases outbreaks, identify high-risk groups, and allocate healthcare resources efficiently in rural and underserved regions where traditional medicine is predominant. Predictive analytics can complement grassroots health practices and prevent a larger health crisis. Predictive analytics for public health. It's a continuation. It's different charts and graphs and a lot of things we have to use in AI for this purpose. Next, integration into telemedicine platforms. The global expansion of telemedicine accelerated by the COVID-19 pandemic has opened pathways for traditional practitioners to engage remotely with patients. AI-enabled telehealth platforms now incorporate indigenous treatment modules, enabling remote diagnosis, symptom tracking, and follow-up here. These systems expand access while maintaining the philosophical and therapeutic integrity of traditional practices. Regulatory and quality control systems. AI also plays a key role in ensuring the safety and consistency of traditional medicine products. Image recognition software is used to identify plant species and detect adulterants, while AI systems monitor production process for compliance with good manufacturing practices. These advancements support the regulatory acceptance and international commercialization of indigenous therapies. Smart herbal formulation and drug discovery. One of the most promising intersections between AI and indigenous medicine is in pharmacognosy and drug discovery. AI can rapidly screen thousands of phytochemicals, predict therapeutic effects, and identify synergistic actions, accelerating the validation and standardization of traditional remedies. This contributes to growing body of evidence-based traditional medicine products suitable for integration into formal healthcare systems. Here mention some of the drug discovery plan: molecular AI techniques, candidate drugs, sequence AI techniques, structure, and drug encoding AI techniques and results. Drug encoding AI techniques and results. Drug discovery use AI technologies in drug discovery. So conclusion, the integration of the AI into indigenous medical system marks a transformative moment in global health rather than supplanting traditional wisdom. AI strengthens its application by improving accuracy, access, and scientific credibility. This convergence supports a vision of healthcare that is both modern and culturally grounded, global yet deeply local. Moving forward, it is essential that this integration is pursued ethically with respect for traditional knowledge holders and equitable benefit sharing. These are the reference. Thank you.